Hello there, John the osteopath. I'm going to do a video today about knee pain, in particular early osteoarthritic changes that occur both under the patella, the kneecap, and on the medial aspect of the knee and the joint line where the femur comes down and joins into the tibia. Now, one thing that often causes this is weakness in the pelvis. So what tends to happen is the knees, when you're squatting down, come together like that. And that puts a lot of pressure on here. So we need to try and deal with the weakness in the glutes, in particular the gluteus medius, as well as improve the strength in that area and in the quads, and in particular the flexibility of the quads. Because what tends to happen with the quads is the quads get very, very tight, they do all the work, and they pull on the kneecap, and that basically grinds away at the front of the knee joint, so making things like squatting particularly difficult. Okay, so the first thing we need to address, like I said, is the weakness in the glutes, and the way we're going to do this is by doing some glute raises. So simply lay yourself down on your back, and there's a couple of ways to do this. We can do it first of all with two legs, and we do a single leg. So the first exercise we do is popping yourself on your back, hold your tummy in, squeeze your bottom, lift your hips off the ground, and hold for a count of 10 seconds. And make sure the whole time you're doing this, you're keeping your core really tight, okay? You don't want to be overarching your back because you're going to create a back problem. Just focus on the buttocks, only go as far as your glutes will let you go. After 10 seconds, bring yourself back down again, and repeat it again. Lift up, you're going to hold the tummy in, squeeze the glutes, hold that for another 10 seconds, and down, okay? And you're aiming to do about 10 repetitions at a time. Now, with this kind of exercise, because of the nature of the muscles of the glutes, it can be done every single day, but I would recommend that because there's a risk of injury, certainly in the early stages, you may want to do it every other day instead. Now, the next stage is to do this as a single leg raise, and the reason we do it as a single leg raise is because it's more functional. Obviously, when you're walking, you use one leg at a time, but also you're using the stabilizers of the hip, such as the gluteus minimus and medius as well. So the way we do this is we're going to put a pillow between our knees when we lay on our back. Also, you're going to get one leg straight out. So I'm taking this leg straight out, I'm turning my foot outwards, okay? So I'm basically exposing this muscle here, the vastus medialis oblique. I'm keeping the tummy tucked in, and exactly the same thing as before. I'm going to squeeze this buttock. So make sure your head is down, squeeze the buttock, lift the hip off the ground, hold it for 10 seconds, and lower. And lift again, and again hold it for about 10 seconds, and lower. Obviously, don't expect to be able to do as many as you can for both legs, but it's worthwhile maybe just doing, say, 5 initially to start you off, and building up from there. And once you've done that, you're going to have to try and work out the glutes. The best way to do that is with the foam roller. Simply sit down on the roller, like so. Roll your weight onto one side, and then just literally roll your glute up and down. You can work it all the way down to here to get some really tight bits, or you can go all the way up to the top. And now I'm not doing some very stable surface, so I recommend you do it on the floor, but I'm doing it here because you can't see me where the camera is placed. So that's the idea, just literally rock back and forth on there, massaging the glute muscles. Of course, at the same time you're doing this, hold your tummy and keep your tummy nice and tight. A good strong core will really serve you well, okay? Do both sides, of course, and then once you've done that, we're going to try some other exercises. So it's a good idea though to continue the foam rolling, but this time working on the thighs. So pop yourself face down into a plank position like this. Keep your tummy nice and tight. You don't have to engage your glutes for this. Some people recommend you do. I don't really think it really matters because you want to get your abs working harder anyway. So roll yourself down and bring yourself back up, squeezing your abs at the top. So roll down and all the way up. Like so, don't roll onto the knee yourself, and be careful, especially gents, as you come up to the top, you don't want to roll on anything that might be particularly sensitive. And do this for about 2 minutes. And that's the same for the glutes as well. Just roll your body for 2 minutes. What's good about this is, like I said before, is you're working your core at the same time. So you're essentially doing a modified plank. It's a bit easier than a regular plank because the lever is further back. Anyway, now once you've done that, we're going to try and work on to doing some squatting. Now the way I recommend your triangle squats, oh, it's falling down, is we're going to try and do them supported. So get yourself something like a table you can hold on to, or a chair. So in this case, I'm going to bring a chair over, place it in front. Let's move this out of the way. Hold onto the chair, flex yourself with the hips slightly further forward, okay, because you want to try and engage the glutes. Have the knees slightly soft and bent. You can put a bit of pressure on your hands if you need to for this, and simply drop yourself down as if you're going to sit into a chair behind you. If it helps, put a chair behind you so you can actually practice sitting down into that chair. So you're leaving yourself down like that. And if you notice, it's just a bit like a glute kickback. It's that action. So the knees aren't doing a huge amount of work, but it's a good introduction to doing squats. Just going down and coming up. Now, one thing I've done that I shouldn't is I've locked my knees out. So make sure when you go down and then you come up, don't straighten all the way to the top, okay? Don't lock those knees out. Keep the knees partly bent. Maintain the tension on those thighs the whole time to activate them. And the other thing is, if you look, you can't see this here, I'll change the angle a bit. When you're doing this, keep the knees quite far apart. As you do this, just focus the forces on the inside of the knee, here in particular, those vastus medialis muscles that stabilise the knees. So drop yourself down, legs apart, and again there. And again, like I said before, don't lock out your legs at the top, maintain the tension on the quads the whole time. And try and make sure you've got equal pressure on both legs. We're not doing unilateral movements yet. But with this, you should be able to do about 5 repetitions, depending on the severity of damage in your knees. Some people will be able to do this all day long. Some people, like I said, may not be able to do many reps at all, if any. So this last exercise we've covered is something that you should only try if you feel able to do so. And once you've done that, again, repeat the foam rolling, go back over the thighs, loosen these off. If you're unable to stretch, if you're able to bring your legs back behind you like this, you certainly need to roll them instead. But that's me done for now. I'm signing out. I'll see you in the next video. I hope you enjoyed it. If you like it, give it a thumbs up and subscribe to our channel. Take care. See you in the next one. Bye-bye.